So good morning. So my name is Tassin Elio, a level 1 BSN student. So today I'm going to perform the return demonstration on how to administer an oral and internal medication. So for the purpose of this is to introduce the drug and also the medication into the body through the gastrointestinal tract. It will also cure, diagnose, and prevent further diseases. For the preparation, first thing that we're going to do is we're going to check for the patient's chart for any limitations and also for the physician's order or any histories. And then we're going to locate for the corresponding medication ticket and compare it with the doctor's order. So this is to avoid for the medication error, and also the physician's order is the most reliable source, and only for the legal records of the drugs is the client is to be received. So we're going to check. So vitamin C 500 mg, 1 tab OD PC breakfast. Vitamin C 500 mg, 1 tab OD crush and mix with soft food and between meals, breakfast and lunch. Vitamin C 100 mg per 5 ml, 5 ml TIDPO. Vitamin C 100 mg per 5 ml, 2.5 ml Q4PO round the clock. Vitamin C 100 mg per 5 ml, 1 ml Q8PO, PRN for fatigue, and Bacillus clausi ursiflora, 1 milliamp BIDPO. And then we're going to check for any allergies. So there is no allergies of the patient. So now we're going to locate for the medication ticket and compare it with the doctor's order. So vitamin C 500 mg 1 tab ODPC, vitamin C 500 mg 1 tab OD crushed and mixed with soft food in between meals, breakfast and lunch. Vitamin C 100 mg per 5 ml, 5 ml TIDPO. Vitamin C 100 mg per 5 ml, 2.5 ml Q4PO round the clock. Vitamin C 100 mg per 5 ml, 1 ml Q8PO PRN for fatigue. And lastly, we have Bacillus clausi ursiflora, 1 milliamp BIDPO. So after that, we're going to arrange the ticket automatically either by the location of the patient, time of administration, and also by any other some factors. So organization and also the planning will results in the economy and also the economy of the time and the effort. So, and it also minimizes for the confusion. So vitamin C 500 mg 1 tab ODPC, vitamin C 500 mg 1 tab OD crush and mix with soft food in between meals, breakfast and lunch. Vitamin C 100 mg per 5 ml, 5 ml TIDPO. Vitamin C 100 mg per 5 ml, 2.5 ml Q4PO around the clock. Vitamin C 100 mg per 5 ml, 1 ml Q8PO PRN for fatigue, and Bacillus clausi ursiflora, 1 milliamp BIDPO. And then what we're going to do is we're going to bring the requisites in the preparation area. So the things that we are need is the ball pen. We also have the medication cup, mortal and pestle, a drop in a medicine gloss, a plaster, a paper towel, a syringe, and we also have a clean gloves. So we're going to put it into the preparation area. So now that we have done that, we're going to take the one medicine ticket and then we're going to locate the medicine in the box. We're going to read and label and we're going to remove it from the box. So this is the safety check that will ensure that the right medication is given to the right patient. So if not identical, we're going to recheck for the prescriber's written order chart, and if it is the still discrepancy, we're going to check with the nurse that is in charge or the pharmacist. So we're going to take one. So by vitamin C, 500 mg, 1 tab ODPC. Vitamin C, 500 mg, 1 tab OD crush and mix with soft food in between meals, breakfast and lunch. Vitamin C, 100 mg per 5 ml, 5 ml BIDPO. And then the Bacillus clausii ursiflora 1 milliamp BIDPO. So after that we have done locating, we're going to do the first check. In the first check, we're going to compare the name and the dosage of the drug on the label with the name and the dosage of the drug on the medicine ticket. So, and then we're going to check for the expiration date. So for the outdated medication, it is not safe to administer. So we're going to check again. So vitamin C, 500 mg, 1 tab ODPC. So vitamin C, 500 mg, 1 tab OD crush and mix with soft food in between meals, breakfast and lunch. Vitamin C, 100 mg per 5 ml, 5 ml PIDPO. And then vitamin C, 100 mg per 5 ml, 2.5 ml Q4PO, round the clock. And vitamin C, 100 mg per 5 ml, 1 ml Q8PO, PRN for fatigue. And Bacillus clausii ursiflora, 1 milliamp BIDPO. So the next that we're going to do is we're going to wash our hands and don the gloves. This is to prevent the spread of microorganisms. So now we are on the oral medication. So there, in the oral medication, we have the tablets and also the capsules. So first thing that we're going to do is the second check. In the second check, we're going to compare the name and the dosage of the drug on the label with the name and the dosage of the drug on the medicine ticket. So this second safety check, it will reduce the chance of the error. So after that, we're going to place the package directly into the or we're going to place the package of the unit dose or the capsule or the tablets directly into the medicine cup, and then we're do not remove the wrapper in the medication until we are on the bedside. So the wrapper keeps the medication clean and also not removing facilitates the identification of the medication in the event that the client refuses the drug or the assessment that drug or the assessment data that indicate to hold the medication. So an unopened unit dose of the package can be returned into the medication cart. So if we are using for a stock container, we're going to pour a required amount of or number into the bottle cup, and then we're going to transfer it directly into the medication cup. So we're going to transfer it without touching the tablets. So in this, this is to prevent for the contaminations of the drugs, and also the drugs are expensive and wastage should be we are avoided. So after that, we're going to break the scored tablets only if it is necessary to obtain for the correct dosage. So we're going to use a file or some cutting device if there is needed. So we're going to check for the agency policy first, as whether the unused portion of the medication is to be discarded, and if so, how they are to be discarded. So for the scored tablets, it has a marks or a grooves that which to split the medication, and also for the proper usage of the cutting device, it will give the facilitation to have an equal distribution, and also it will prevent for the crushing of the medication. So after that, so if the client has difficult to swallow the medication, what we're going to do is we're going to crush the tablets. In crushing the tablets, we're going to check to make sure that the tablets may be crushed into a powder or a fine powder with the use of the pill crusher. And then we're going to mix it with a small amount of food such as an applesauce. So in case of the dysphagia, the soft food is easier to swallow, that it will clear the liquids, and also this is to prevent for the patient aspiration. So after that, we're done in the tablets. We're on now in the liquids, in the medicine cup. So first thing what we're going to do, as usual, we're going to do the second check. We're going to compare the name and also the dosage of the drug on the label with the name of the dosage of the drug on the medicine ticket. So in this second safety check, it will reduce the chance of error. So we have vitamin C 100 mg, 5 ml, 5 ml TDPO, vitamin C 100 mg per 5 ml, 2.5 ml Q4PO, round the clock, vitamin C 100 mg per 5 ml, 1 ml Q8PO, PRN for fatigue. So for that, first thing that we're going to do is we're going to thoroughly mix the medication before we're going to pour it. So we're going to discard for any medications that has changed into the color or turned into the cloud. So this is to evenly distribute for the drug components, and especially for those who are the reconstitute with the reconstitute powders, suspension, and also those with precipitates. So after that, the thing we're going to do is we're going to remove the cup and place it upside down into the counter. So this is to avoid contaminating the inside of the cup. And then the thing that we're going to do is we're going to hold the bottle with your dominant hand. So this is my dominant hand next to our palm. And then what we're going to do is we're going to pour the medication away from the label. So this prevents for the label that being soiled and also legible, which can result for the spilled liquids. So after that, with the second hand, we're going to place the medication cup at our eye level, and then we're going to fill the desired level into the medication cup. And then we're going to pour use for the bottom of the manissus to align with the container scale. So this method will ensure for the accuracy of the measurement. So we have 5 ml. So, the thing that we're going to do is, next is before cupping the bottle, we're going to first wipe the lip. So, this is to prevent from the cup from spilling. And then we're going to cover it. Now that we have done, we're going to do for the liquids which is in the dropper. So, first thing that we're going to do is we're going to do the second check. So, in the second check, we're going to compare the name and also the dosage of the drug on the label with the name and the dosage of the drug on the medicine ticket. So, this second safety check will prevent or reduce the chance of error. So we have vitamin C 100 mg per 5 ml, 2.5 ml Q4PO round the clock, and vitamin C 100 mg per 5 ml, 1 ml Q8PO PRN for fatigue. So next thing that we are going to do is when we are giving the small amount of the liquids or medication, example for less than 5 ml, we're going to prepare the medication in the syringe or the sterile syringe without the use of the needle. So, we're going to use for specially designed oral syringe or the dropper. And then what we're going to do is we're going to label it, or the label the syringe and also the dropper with the name of the medication, and also for the root PO. So for any oral solution, we're going to remove it from the original place or container, and then we're going to place it into the syringe or dropper, and it should be labeled. This is to so that the medication is given, so that the medication, or so that we can avoid for the medication that being given by the wrong route. So first, we're going to open it with the syringe. Then we're going to put it here. So we need 2.5 ml. And then we're going to put it into its container, and we're going to label it. Let me see. 100 mg per 5 ml, 2.5 Q4PO. So we're going to do the same procedure in the dropper. So we have 1 ml. Then we're going to put it into the, we're going to place the dropper into the that have a medicine into the medicine gloss. This is to prevent for the contamination. Then again, we're going to wipe the lip before cup. So now that we have done, now we are on the liquid which is in the special package. So in the special package, we're going to do the second check. In the second check, we're going to do the compare the name and the dosage of the drug on the label with the name and the dosage of the drug on the medicine ticket. So this second safety check reduces the chance of error. So, Bacillus clausi ersiflora 1 polyamp PIDPO. So, after that, we're going to keep the unit dose liquid in its package, and then we're going to open them when we are at the bedside. So the package is makes the medication clean and also not removing for the medication will facilitate the identification of the medication in the event that the client refuses the drug or the assessment data indicate to hold the medication. So for the unopened unit of those package, it will be, or it usually can be returned into the medication cart. So we are done. For the medication, before going to the bedside, for the medication that we are going to the bedside, first is we're going to do the third check. In the third check, we're going to compare the name and also the dosage and the route of the drug on the label and also on the medicine ticket. So this third safety check, it is to prevent from having the medication error. So after that, we're going to perform hand hygiene. This is to prevent the spread of microorganisms. And then lastly, we're going to do or don the gloves. This is to protect the nurse hands. Good morning, sir. So now we are going to do the medical administration. So in the medical administration, the thing that we're going to do is we're going to take the medication with to the client within 30 minutes before or after the scheduled time. So taking the dose too soon, it will lead to the drug levels that are too high and also missing the dose. It will or we're going to wait for too long between the dose. It could lower the drugs of on the body, and also it will keep it from working properly. So after that, we're going to provide for the client's privacy. In providing the client's privacy, we're going to close the door or the window, and this is to provide for the emotional comfort to our patient. After that, we are going to introduce ourselves to the patient, and this facilitates for the communication to the patient and also builds the rapport. So, good morning, sir. Ako gali ang nurse Musubong, sir. Ako si Dusty, sir. So, after that, we are going to verify our client. The thing that we're going to do in verifying our client is to ask the client to state his or her name. And then, we're going to check for the patient's identification bond. So, in this procedure, the proper identification of the client, it will prevent from the drug that being given to the wrong person that may lead to the fatal effects or else the skip of the dose for the patient, and also the litigation occur from the medication error. So, sir, ano pangalan mo, sir? Yung lang po hambal, sir? 30 Elio. Excuse me po, sir, ha? Natawag ka na. Okay. So, after that, we are going to explain the procedure to the patient. In explaining the procedure, this will exchange the information and also alleviates the fears and promotes for the cooperation. So, sir, subong maghatag lang po sa mga vitamins na dapat mo-inom. Kagtanig mag-participate kita, sir, ha? So, after that, we're going to assist the patient into a sitting position. If not, we're going to assist him into a sideline position. So, the proper position, it facilitates for the proper positioning of the body, and also prevents for the aspiration of the drugs and also the fluids. So, since the patient is in sitting position, we're not going to ask him to the sitting position. So, after that, what we're going to do is we're going to give the patient a sufficient amount of water or preferred juice to swallow the medication. So, before using the juice, we're going to check first for the food and medication incompatibilities. So, the fluids rather are easy to swallow, and also it will facilitate for the absorption from the gastrointestinal tract. So, we're going to sir, palihog lang ko nga, sir. Okay na, sir. Kailangan, sir, ha. May drop pa ta, sir. May alak pa ta nga bacillus crossy. Sir, palihog lang ko. Alright, sir. Last na lang ni sir. Bacillus crossy, sir. Thank you, sir. So, after that, so if an older child or an adult has difficulty in swallowing, we're going to ask the client to put the tablet or place the medication into the back of the tongue. So, before he or she is going to take the water. So, the stimulation of at the back of the tongue will produce for the swallowing reflex. So, after that, if the medication has an objectable taste, we're going to ask the client to suck ice chips or just a few ice chips beforehand, or give the medication with a juice, bread, or an apple sauce if there is no contraindications. So, in this, the cold ice chips will desensitize the taste buds, and also the juice and the bread are the one which mask for the taste of the medications. So after that, so if the client have say that the medication that they have received is different from the medication that you have given is different from what the client received, we're going to we are not going to give the medication directly but we are going to first do the checking of the original order. So we're going to first check the original order. So most of the clients are familiar with the medication or the appearance of their medication that they have received or take, and unfamiliar medications may signal to the error of the medication. So after that, we're going to stay with the client until all the medication have been swallowed. So the nurse are the one who will see the client to swallow the medication before we're doing the drug administration that we are about to record. So, sir, thank you kayo, sir, sa preparation mo, sir, ha? Paayo lang din, sir. So now, after we have done the administration, we're first going to remove our gloves. In removing the gloves, this is to prevent for the spread of the microorganisms. After that, we're going to return the medicine ticket into the place that which is provided for them. So the careful management of the medication, the careful management of the medicine ticket will reduce for the possibility of error and also the loss. So after that, the thing that we're going to do is we're going to dispose the supplies appropriately. So in disposing, this is to prevent for the spread of microorganisms and also the biohazard. And then the next thing that we're going to do is we're going to wash the equipment, and then we're going to that is being used, and then we're going to dry it and return it into the proper places. So the used equipment must be clean. It also dry. For this is the preparation for the next use to prevent from adding of the hazard to our patient. So it should be returned. It should be returned to the proper place for the easy access, and should not be interchanged between the patient. So after that, we're going to put it here. And then after that, what we're going to do is that we are going to perform the hand hygiene. We're going to wash our hands. This is to prevent the spread of the microorganisms. So we're going to wash our hands. we're going to document for the we're going to document for each medicine given. So we're going to record for the medication that given, which is this is for the proof that the drug is being assessed or the drug is being administered to our patient, including the dosage, the time, complaints, and or the assessment of the client, and also the nurse signature. So, if the medication have been refused or if it is omitted, we're going to document the appropriate record, including the reason why the patient refuses. So, So after that, we're now going to evaluate for the medication. This is to watch out for the untoward signs and also the symptoms after the medication or the administration of the medication. So that's all for the our return demonstration.